again. You look good. I like the hair.
Thank you.
Thanks again for doing this. This is really, really big help, not just to me, but to other lipedema patients. So just wanted
Right.
to say thank you for that. I appreciate you taking time out of your day to do this. And it's meant to just be a conversation, just like how we would do our virtual consults, or if we were doing one of our post-ops or something like that. It's really meant to just be educational or informational. We're not necessarily trying to sell the office, but just someone that's had a really impactful journey with lipedema and surgery. And I think you'd be really great to speak to that. So if you don't
Yeah.
mind, do you mind introducing yourself and telling us a little bit about yourself and how you came to find us?
My name is Michelle. I actually came to find you just like kind of by Googling. I had some symptoms that I was dealing with, some lumps and some bumps, and just, like doctors just saying, like, oh, it's fat. And I'm like, well, yeah, it looks like fat, but it doesn't feel like fat. So being basically immobilized from these large like nodules that don't, like, they hurt me, but they're not really showing up on anyone's radar that I'm trying to report it to. So however long of Dr. Google and going down a rabbit hole, I found lipedema in general. And then through that, I was able to be participate in quite a few lipedema Facebook groups. And through that, really got some experience of other women talking about like their surgeries, what had happened with them and stuff. And it's just such a small community to begin with. So it was really, obviously validating to hear other people going
Right.
through it. Through that community also, though, and Google was able to put these together to find you. And through finding you, I was able to see like, okay, well, there's this guy who's new, he's younger, and he worked under somebody who has experience with lipedema. When I ended up going and having a consultation with you and meeting you, I was like, it wasn't just all of that, which was like good enough, not, maybe not good enough, but almost good enough to start with. But the validation that I got when I spoke with you, when you're just like invalidated or told that it's all in your head for years, it's just that little bit of validation. I know you gave me more than a little bit. And so it was like, well, this is the person. Like, I don't really want anyone else to, I don't really trust anyone else. This
Right.
is like a very like crazy thing that's like evidently rare, and yeah.
Yeah, and I remember meeting you for the first time, and I mean, seeing you now versus seeing you then, I mean, you're a completely different person. I mean,
Yeah.
you're obviously like a very colorful personality, and you do art, and I know that, but other people might not know that. But meeting you the first time, I mean, you really seemed like you were a kind of a shell of the person that I imagine you used to be and who you are now. And I mean, you were almost like essentially disabled from the lipedema being so severe.
Absolutely. They were my insurance company. Instead of like any sort of validation or like understanding what I was going through, they wanted to put me in a wheelchair. I was disabled. I was heading that direction. And so it was like, surgery and going, and changing my life, taking a chance, I guess, which doesn't feel as much like taking a chance when you don't really have many other options. It's
Sure.
just like, get me out of this bed.
And I think, we're lucky that we found each other, because I think you've been a fantastic patient, and you seem to have had really good results from the surgery. But I think it can be really challenging for some patients, because they can feel that desperation. And sometimes they'll go to someone that's either not safe, not experienced, and they're just wanting to get help. They just want to feel better and get their life back. A lot of them do feel that desperation, and sometimes they just want relief, and they'll kind of go anywhere. And I think that's one of the things that stood out most about you, is that you seemed like you were, you would have begged, steal, and borrowed to get this surgery done, because it was affecting you so profoundly. And one of the things that I really wanted to talk about was that, your insurance wanted to try to cover the surgery. I mean, we tried to work on that for months and months, and eventually you kind of threw your hands up and you're like, you know what, I just need to get this done. I need to like start feeling better. And that's one of the challenges that we face with a lot of patients, is that insurance companies still haven't quite come around to thinking that this is medically necessary, or they throw up hurdles at every step of the way. So Do you mind speaking a little bit about your experience trying to get this approved through insurance?
Man, yeah, everything that you said is true. They kind of set you up to believe that you will be taken care of, and like you have to do like so many hurdles, which is insane to ask of a very sick person that can't really, so you have to have people that advocate for you almost in a way, or that's how insurance made me feel. Like I would get really excited thinking like this is going to happen and this is great and I deserve this because like we paid the insurance and it's literally in my contract or whatever. And now I'm having to like prove that I'm disabled even though I was asking for a wheelchair and things like this. And I've spoken like ad nauseum, like on the phone for hours and hours and hours, days and months on end with just trying to explain to them like this is in my policy.
Right.
Like please have this doctor, he gave the CDC codes or whatever they're called. And I was at the end of my rope as far as like energy and effort and like because I couldn't take care of my child, let alone like now I'm trying to like advocate for just someone to help me.
Yeah, and I think that is the experience of a lot of different patients too, and it's hard enough to find a lipedema surgeon that's in your area, so you don't have to like travel great distances. But then also, you want to make sure that it doesn't financially ruin you just to like get your life back and function like a normal person would. So I think it's coming around. It's certainly getting better every year, but it really is unfortunate when you're the one that kind of has to blaze the path for everyone that follows you. I would like if you wouldn't mind speaking a little bit about how things have changed since your surgeries. You've had two now, but if you could speak a little bit. I know the first one was like a really big game changer for you. Do you mind just talking a little bit about that?
Yeah, so man, my first surgery, I was 100% like every day. Maybe I could get up for maybe 20 minutes. And I mean, I had an issue going to the bathroom. My bathroom's right around the corner from my bedroom. So the pain is like a constant like toothache, but it's in your hips or the pelvic, like thigh, all that area. And you try to tell the doctor that, this hurts. So you're just like, it's mental and physical, the whole thing. So I was really nervous and so excited to like, let's get this done. Like, let's just, because I can't walk. Like, this is it. Either it's like, am I going to be able to walk again or am I just going to stay in bed? So it was a choice like that. But it was also, I was so excited. I was very scared, but I was like 1,000 times more excited than I was scared because I was so ready to get my life back on track. So I have the surgery, right? And you get scared of all like what's gonna happen, like am I gonna get a serotoма or am I gonna like any of those things. But everything for me personally was like 1,000 times like the pain that I felt every day was it's like absolutely nothing compared to the recovery or the surgery itself. The surgery itself was obviously a dream. You guys are amazing. I drove home. Well, I didn't drive. My husband.
It's like, you better not have driven home. You're on medicine.
No, my husband drove me home back to Portland, which is just a couple hours away. The drive was fine. Like, I was fine. Obviously, I can very, very much say it was the best thing I'd ever done, like, for my family and my mobility. Just after that surgery, though, I was finally able to start getting out, start doing things again, start being able to, like, exercise, like, pick up my daughter. But I was still having some issues. So I was like, look, like I still have some surgeries to do, like to gain like, like basically 100% of my mobility back. I'm thinking I need this other surgery too. So we got that hooked up and that surgery it's just like absolutely life-changing too, because I was having this issue. I had these huge lumps and that fibrous material, like right above my belly button and all the way around. And so it's such a strange place to accumulate fat or lipedema fat, because it's not even like fat. And it was really, really painful though to bend over to tie my shoes, to pick up things. I was still getting a lot of relief from my hips because I could now forward propel, but bending over was. So after that surgery, I mean, it took a week maybe for me to be able to just like feel like, wow, like I was still swollen, I was still like everything, but like none of that mattered. Like I was walking around. I was like, I was able, I maybe like, I didn't think I'd be able to do this, but I was able to, like a week after, get on an airplane, fly all the way to Boston to my in-laws.
Right.
And prior to this, like, I couldn't even like fit on a plane, So it was like, oh my God, like this is awesome. It's just been like every month, like better and better and better, because
Right.
the swelling, obviously, it's been like over 6 months now. It's
Mm-hmm.
definitely went away. I guess about 9 months now.
Yeah.
And I can bend over. I joined like a gym. Like I can go hiking. Like we used to go hiking, but I wouldn't be able to like go very far. But now
Right.
I can do whatever I want, and I can literally say that. Like I can do the things which I can tell you, like back when insurance was trying to put me in a wheelchair, like I never in a million years thought I was going to be like anything but that shell of a person.
Right. One of your stories that really stood out to me is you just shared it was about the airplane. I know that was like a big deal for you because you felt like you couldn't really fit in the seats and like you couldn't stay and like be comfortable, and like if there was turbulence you couldn't like get up and it was too painful to do it, and you couldn't go see your family because of it. And that was like the subtext was that there was like a little bit of like a strain on like relationships and things like that because you couldn't be there, and it was like, is this ever going to be possible again? And like by doing the surgery, all of a sudden like, wow, I can like sit now and like I don't hurt as much, and like I can go see like the people that I care about.
I couldn't even go out to dinner with my family because it was too uncomfortable to get out of bed. I couldn't, it was a big production for me to open Christmas presents with the family. I had to bring out my heat pad and,
Yep.
Make sure I had all my provisions. And it's just so, you get used to it, but it's just like, oh boy, like it's a lot for
Right.
something like that to just go ignored for so long.
Right. I think one of the things that really stands out to me about your story also is how open you've been on social media about it. You're kind enough to always tag us when you post something about it, but it's all, very, very supportive and very positive. And, the last couple months you were sharing an update and you've had great results after both of your surgeries. Do you mind speaking about that a little bit?
So since my surgeries, I've lost almost, probably maybe 80 pounds, a little bit over, around 80 pounds, which after my second surgery, it just started, just my mobility became back. So like instead of, not being able to like walk up the stairs to go, get my daughter or something, I can run up the stairs, I can go do whatever, I can go to the store, I can go, I was literally, and I don't understand, like, I don't know if people actually understand, like literally bedridden, like could not leave my bed. Like had to buy a bed that lifted up and lifted down and stuff because of my mobility issues. So I haven't even used the remote for my bed, and like I don't even remember. Like I don't need it anymore. Like I just use my bed stays flat, which just sounds stupid or whatever, but it's just one of those things, like I don't have to use my mobility aids anymore. And it was getting bad, like canes and wheelchairs, and like I'm still pretty young, so it was pretty sad.
Totally. Yeah. If you were a patient that was just kind of starting out and assuming like this is the first video that they come across, for someone that's kind of like lost in information or information overload, like do you think there's anything that would have been helpful for you to know when you were first getting started on your journey to getting lipedema surgery?
What was kind of vital to me was, this might sound silly, but joining different groups, or at least finding other people that are kind of going through it, because you probably have already had a lot of mental, is this my fault? What have I done to myself? Like, is this just fat? Like, if I could just only, not eat less or not eat as much or exercise more, or those ideas will just like eat at you. And the thing that helped me the most was finding other people, and all those people will give you access to information too, even through their own personal journeys. So it's that, you can Dr. Google all day, but like learning through other people is the most important thing to me.
Yeah.
I think.
And it's like that validation you were speaking about earlier. Like, I think it's important for a patient to know, like, this is not a moral failing. You're not failing at dieting. You're not failing at exercising. It's like, this happened. It's a diagnosis that you have. And, what do you want to do with the information? Do you want to try and do things to make yourself feel better? Because you can like really get lost in despair and there are ways to make it better, but I think it can be very, very overwhelming, I would imagine, for a patient.
And medical stuff hitting you, you're not going to feel, I mean, maybe you can, but most people can't quite sort that through in their head without placing blame on themselves.
Totally.
So yeah. So having those other people there, validation and understanding that it's not your fault. There's all things that we could all do to be better, but generally people suffering with lipedema have tried about everything. So
yeah. Do you notice that now, like that you're a year out from the first surgery and 9 months from the second one, do you notice that like the people in your group around you are like, they notice like the different you, not just that like you've lost the weight? I mean, like I'm sure people, it's hard not to see that. I mean, you look fantastic, but that they're noticing that your energy level or your mood or your ability to do things, like come out and do things that you weren't able to do, are people kind of like giving you positive affirmations about stuff like that?
Yeah, I mean, I came from not being able to do anything, and people are like, "Oh, wow, you're back." My family, who, due to insurance not exactly helping me, pushed it forward and, paid for the surgeries. And for them, like, they're really seeing money well spent. Like, I'm back where I was not good for like 6 years. That's very, very, very long time. Like, for someone to be kind of down and not able to like keep up with everybody. If everyone wants to go for a family hike, or like, we're all going to Yosemite or something. And now, I mean, let's go. Like, I can do anything.
Good. Yeah. Do you have anything that you want to share about, like, we talked about, your initial consult when you came in and, the surgery a little bit. Is there anything that you think would be helpful to know for someone that's like trying to choose between lipedema surgeons or an office? What is like important to look out for, or maybe like what to avoid when choosing a surgeon or an office to get your surgery?
I've had a few other surgeries in my life and I didn't really get to choose my surgeon, so I did feel like I went through a list and a number of people. There were some options that some people had already been approved through, so I knew that might have been an easier path maybe. But for me, and I know that other girls will, really emphasize, like, do your research essentially. You want to make sure that the person that is working on you is not, going to hurt you any further. But also, sometimes people just don't mesh, and like you want to, especially if you're going to be awake and you're going to be with the person, you don't want to be having like a panic attack the whole time because you're not comfortable with the person. And some people like can choose to be asleep, but I chose to be awake, and I would never, like, why would I choose to be asleep during that process? I felt like I was helping, like, cure myself. You were helping me, obviously, but I was a part of the process, and it mentally helped me a little bit better. But regardless if you're awake or asleep, knowing that like this surgeon and you are going to, you're on a path together to be better. And if you don't get that feeling, like, there's other surgeons out there.
Totally agree. Yeah, it's you don't have to be, from my perspective, I don't need to be every single person's doctor. There might be some people that, they don't like my attitude, or they don't like my beard, or I don't know, whatever. But it's fine, and it's like not personal. It's like you have to choose what's going to be the right thing for you geographically. The surgeon, their experience level, all that stuff needs to really sync up, because it's your life. You don't want to be harmed anymore, and you want to make sure that you don't want to have to pivot in the middle of your surgical plan. You want to have someone that's you're totally comfortable with from start to finish. So.
Exactly.
Yeah. Anything else that we haven't talked about that you think is worth sharing, or that you would want to know if you were just starting out?
Considering how long processes with insurance, or with even like consultations and stuff for your own schedule can take, start a little bit early. Like, maybe you don't have things exactly in order, but if you can just like start the ball of like getting that conversation going, getting a doctor that you can speak to that will validate you, you're not just going to be sitting at your computer, like, upset about your symptoms. Like, you're going to have this feeling of, what, like, I'm going to move forward, and this isn't going to be my forever. A lot of us will just not go forward because we're a little afraid of, well, I don't have the money. I don't know how to call insurance. I don't, for me, like my insurance is through my husband. It's kind of a little daunting because I don't really know how to, I understand all that stuff. Get started early because
Hmm.
it's a journey.
So Michelle, one of the unique things about your situation is that you were traveling from Portland, which is about 2 to 2.5 hours away. Can you speak a little bit about what it was like recovering a few hours away, and did you stay in a hotel after surgery? Did you go home? What would you do, in hindsight, and how did that affect your care and your recovery?
I feel kind of lucky because I only live a couple hours away.
Hmm.
But that said, honestly, even if I lived 8 hours away and had to get like on an airplane, it might be so scary to get the surgery, but lipedema is so excruciatingly painful that like if you're dealing with that pain, there's almost no pain that after surgery is going to phase you. And
Hmm.
so for me, traveling was a breeze. Both times I had no issues in the car.
Hmm.
I no issues at all. I got home. I wouldn't have wanted to recover anywhere else but my home.
Hmm.
Me personally, though, I also had all my provisions with my movable bed and stuff like that.
Right.
So I wouldn't have wanted to be in a hotel because I didn't have those things.
Hmm.
But if I had to recover in a hotel, the hardest part is having lipedema.
Hmm.
All of that afterwards is it's all downhill.
And then, you didn't find it was too challenging to come up here for post-ops or for your initial consult or anything like that?
No, I mean, and it's for me, like I would have drove further or been even further inconvenienced because this is like it's my life. Like it's worth it. Like and I needed, more validation after the surgery of like, wow, this is looking good,
Hmm.
and so yeah, I had no issues at all driving back up or coming back up or any of our communication. Like you were very communicative and I'm a distance, but nothing went wrong at all. Like I think on my first surgery I thought maybe because I didn't have any experience or anything, I'm like, oh, is this a seratoma? And we just, drove up to Gig Harbor and
Hmm.
you checked it out and you're like, no, you're good. And I felt so much better, and then my
Right.
second surgery I knew like, oh no, this is totally fine. I'm great. And I was.
Yeah, and I think that's one of the important things I try and stress to out-of-town patients is if you're really far out of town, you probably want to stay for a couple days afterwards just in case you have some sort of issue. If you're not so far, you're an hour to 2 hours away. I usually don't mind if you go home as long as like if there's an issue, you got to be willing to come back right away. And most patients are good with that, and they're like you. They'd rather recover in their home where they've got their own stuff around them and they've got their own support system. But it's just having that open communication and dialogue where if you think there's something going on, there's a reason you have my
Right.
cell phone. I want to know right away, and then we have to get you up here. Whether it's, we always save a spot at the end of the day for patients if they need to come up for a clinic issue, and then I'm usually available most weekends if someone needs to come up for like a real emergency. But yeah, again, I think it's that open dialogue and open communication between me and the patient.
I mean, and you're amazing at that. I can hit you up on Instagram. I can hit you up through email. I can hit you up through text. Like you're available through like all facets of communication, which is really cool because I don't have that type of, hey, like, am I okay with any kind of
Hmm.
other doctor? Nobody, I
Yeah.
don't, that's the relationship you have with your patients is just, it's awesome. It gives people so much like, this person has my back instead
Hmm.
of like this person is a doctor and maybe they care, but I don't really know.
I'm hyper about things. I'm pretty controlling about my patients. That's my cross to bear. I like having my my fingers in everything that I do. So it's really important to me to know that you're comfortable. You're taking a risk coming to see me and get treated by me. So I want to make sure that you're doing well. I don't want you to feel stressed afterwards, or if you're worried about something. Sometimes I can answer a question in 15 seconds and you're like, oh, okay, thank goodness. Like now I don't have to worry about that anymore. And it's just, I'd rather do that than have you like worry about it for a full day and not get sleep and, get yourself all twisted up. So I don't know, that's just me.
No, and like, a lot of, I don't know any other doctor that does that. So that's pretty rad. Like obviously super rad.
Thank you. So I really appreciate you taking the time out of your day to do this, especially like really, really short notice.
For
I
sure.
think this is going to be really helpful. I think a lot of patients are going to find a lot of benefit from this, not just because you had issues with insurance, but you're coming from out of town. And I mean, you just had such a dramatic improvement. I mean, every time you put a post out on social media, I'm just like blown away by how well you're doing. So I really appreciate you sharing with everyone.
Yeah, and I'll continue to share. I reach certain levels of like, oh my God, is this really happening? So
Right.
yeah, it was life changing for me. I mean, I know people can say that about a lot of things, but I was in a very, very, very dark place, and I'm alive now, like real alive.
Thank you so much, Michelle. It was great talking to you again.
Thank you.
Tell your husband I said hi, okay?
Okay.
Oh, you're right here. Yeah, hey, I figured you were around. It's good seeing you, man.
Yeah, catch you later.
See ya.
Bye.
Bye.